Hi, everyone. Welcome back. Today, we're joined again by Dr. Eddie Stenehjem to give our community update on what's been going on in Utah with COVID-19. Eddie, thanks again for joining us. As always, we really appreciate it.
You got it.
So as always, I want to talk a little bit about case counts first, go over the data from yesterday and kind of what the total has been for the state. So as of yesterday, we've had 35,578 total cases. Yesterday's specific case counts was 544 with a 9.5% positive rate. We have a total of 260 deaths in the state and 2,135 hospitalizations. Eddie, let's talk a little bit about what that means for people. Break down the numbers. How are we doing in our hospitals, and how is that positive rate doing?
Yeah, so when we look at the numbers at a state level at a whole, we certainly see continued increase in cases. However, it does look like there may be some flattening of the curve. The last 3 days in a row, the state has reported less than 600 cases per day. Yesterday we had 590. So I think we're starting to potentially see some changes at a state level. When you break this down, though, and look at Salt Lake County versus the rest of Utah, you are seeing some differences. And in fact, Salt Lake County's numbers are declining, and they've been declining now for the past 7 to 10 days. While when you compare that to the rest of Utah, the rest of the Utah numbers are increasing continually. So we're seeing some regional differences in the case counts, and that likely is driven by the more prevalent mask use here in Salt Lake County versus other areas. But time will really have to tell in terms of what that difference is really due to and how that evolves. Our hospitalization numbers, fortunately, have remained relatively stable. We're at, within Intermountain Healthcare, we're at about 170 people hospitalized in our hospitals right now. That number is relatively flat, and it's kind of remained at that level now for the past 10 days or so, which is such good news for us. And the reason that's good news is that we can continue to provide care to patients that come to seek care for non-COVID related things, heart attacks, traumas, etc. We think that the reason that we haven't seen more of a surge in our numbers is the fact that when you look at who's getting infected in Utah, the growth in the younger population is much larger than the growth in the older population. And so in that 15 to 24 age group, we're seeing a really significant rise in cases. And those people are less likely to get hospitalized because they have fewer comorbidities. And so we're really seeing kind of an attenuated surge in the hospitals, likely due to the growth being predominantly in younger people in younger populations. It's clearly a target for us in terms of prevention, in terms of who we need to target to slow the spread, clearly, but fortunately hasn't led to increased hospitalizations. The death rate, however, like we kind of said, the death rate will lag considerably after cases. We're starting to see that pick up. We had 10 deaths reported yesterday, which is the most deaths that we've seen recently. And so we're starting to see more and more deaths reported, likely due to this lag from the surge that we started to see in June and into July.
I want to touch base really quickly on the number of tests that Intermountain itself has been performing. So our 7-day average is 3,100, which is a slight decrease from the week before. Someone asked if we're seeing a lower number of cases because we have a lower number of tests, but the positive rate is really what we should be looking at because that hasn't really gone down. Do you want to just touch really quickly on what the correlation is between the number of tests, the rate, and then the actual daily case counts that get reported?
Yeah, so really focusing on our test positivity rate, especially among those that are symptomatic, is really important because that really gives you a better sense of community spread. If we just started increasing our testing and started testing asymptomatic people and just tested everybody, what you'd anticipate seeing is that your test positivity rate would go down and you'd get really low because you've really increased the pool of people that are less likely to be infected. Compare that to if you really minimized your testing and tested only people that you really think are positive, like those coming into the hospital in respiratory failure, well, then your test positivity rate would go really way up. And so it's a nice way to keep an eye on your test positivity as a marker of community spread in relation to your testing practices. Our testing is going to ebb and flow. And looking at the state data, not Intermountain data, but the state data, our testing has actually increased a little bit over the past week, most likely because of increased community spread and more people having symptoms. But we've been remaining relatively constant at our test positivity rate at right around 10%.
So along that lines too, I want to really quickly just talk about masks and a couple of different things that have happened in the last couple of days and weeks. A lot of big box stores, Walmart, Target, Kroger, which is Smith's here, Harmon's, are now requiring masks regardless of if there's a mandate in that county as well. I think it's really important to point out that when you go to these stores, you are requiring to mask up, and it looks like we're potentially seeing that effect. But do you feel like wearing a mask will become more widely accepted if these retailers and stores that you normally frequent are asking you to do so?
Yeah, absolutely. It's just going to normalize wearing a mask. If you're going to walk into Smith's, if you're going to walk into Harmon's or Walmart, you're going to have to wear a mask. And I think it's really smart because it just normalizes the use of masks across the state of Utah, regardless if your county or your state or your city doesn't require it. And I think this is very socially responsible for these stores because these stores know that they have to have a healthy workforce to continue to be open. And so us wearing a mask as we walk into the grocery store is protecting those essential workers that are selling our groceries, that are working at Costco or at Walmart. We're doing this to protect them so that they can stay open and so that our economy can flourish. And so this isn't about us. We have to think about what is our social responsibility here in the state of Utah, and that's wearing a mask. If we want our big box stores or even our small boutique locally owned stores to stay open, we need to protect those workers. And the way you protect those workers is to wear a mask. And so wearing a mask, really allows our economy to continue. And so we stop the spread to those workers and allows those stores to remain.
Another thing I really quickly want to talk about is when not to wear a mask. And if you're watching right now, you see Eddie and I are not wearing masks. We're not in the same room or building for that matter. But do you want to talk about when you should and should not be wearing masks and what the risks are for that?
Right. So, I'm in a 3 or 4 person office. You see the doors closed. Nobody's in here with me. So this is not a time where I need to be wearing a mask. I'm at my personal workstation. And I'm not exposing anybody else. If there were 3 or 4 other people in here with me, yeah, I should wear a mask. But right now, I am physically distant from anybody else, and I'm not exposing anybody else to the coronavirus that I may have in my nose or my mouth. However, if I were to walk out that door into my clinic and see our nursing staff, our medical assistants, our pharmacists, then I need to be wearing a mask because I'm going to be coming in contact with them. Other areas of times you don't need to wear a mask would if you're alone in your car. If you're alone in your car and you don't have any passengers, you don't need to wear a mask. But if you go and you pick up 4 kids to go to soccer practice, well, now you're being exposed and everybody in that car needs to wear a mask. Anytime that you can't physically distance, you're coming into contact with people, you need to wear a mask. And so, think about it, be smart about it, but, you don't have to wear a mask all the time. It's only when you can't physically distance from those people that you're coming into contact with.
And I just like to point out for me, I am also by myself and the camera that's on me was set up before. So yeah, we want to do these Facebook Lives and give you guys these updates, but we also need to make sure we're staying safe as well. So that's something to note. There's been a few questions about school that have popped up on the Facebook Live. And I just wanted to tell everyone really quickly, we are going to be doing a school specific and children COVID-19 Facebook Live at 1:40 today. So those kids' questions that are coming in, we'll have a couple of other people address those. But Eddie, we're going to ask you really quick about teachers with schools. There's been a lot of teachers that would like to know if there's any specific precautions that they should be taking, if there's any specific types of masks they should be wearing, hygiene practices they should be doing at school and when they come home, and also how they can be of help to the children that are actually in their classroom.
Right. So, we know definitively that a teacher is going to have to wear some sort of face covering to protect their children that they're teaching, and also likely have some protective effect for themselves as well. We don't have data comparing the types of face coverings and which are more effective and which are least effective. We do have lots of history and lots of data in terms of surgical face masks. Okay? So these are the things we wear in the hospital. And it may come to that, Salt Lake or other schools may provide surgical masks to teachers. And if that's the case, I would wear a surgical mask. That said, a cotton face covering done well in terms of multiple layers is going to be very effective. And our data has shown that it is effective. And so modeling a good face covering, regardless if it's a surgical mask or a cotton face covering, is absolutely essential for teachers. And really showing what good mask wearing looks like is going to be important to those kids, and really modeling that behavior, and the fact that the face covering isn't under your chin. It's not just covering your mouth, but it's actually covering your nose and your mouth, and you're not touching it and you're keeping it there as much as possible. So I think really modeling that good behavior is going to be essential. We know that the kids aren't going to do this perfectly, but we are really going to hope that they can do it somewhat. And I think Dr. Hirsch and Thorell, who you're going to have on shortly, are going to certainly expand on that topic.
In regards to face masks too, I think it's really important to know how to take one off properly. So I have mine right here. And I've heard that when you go to take a sip of water or you're going to eat something, that it's not good to actually pull it down here, but it's better to actually remove it completely. That way you're not spreading the germs that were on the outside of your mask and putting them elsewhere. And then also removing it with the two straps as opposed to touching it. So I think that's important too, to make sure that you're practicing proper masking techniques when you take it off as well.
Absolutely right. Absolutely. Taking it off by the ears, take it fully off, set it down, and then eat and drink as you would, and then put it back on appropriately.
Another thing people wanted to know too was if face shields are as effective as masks, if that's a good alternative for someone if they cannot wear a mask for some medical reason, or if they're not providing that same level of protection that a mask does.
Right. So in the hospital, all our healthcare workers are wearing masks and a face shield. And our face shields are pretty extensive. They're pretty big. And what this does is it protects our eyes, and it also protects our mask. And the fact that, if we were seeing a patient that happened to have COVID-19 and they were to sneeze, we have some protection that we're not going to get infected via our eyes. And so we use those together. We don't use a face shield instead of a mask. And so wearing a face shield by itself is not going to be as protective as wearing a mask. A face shield may be good if you're really concerned about exposures in your eyes, but a face shield by themselves, especially we're getting some early reports of people able to get infected if they wear just a face shield, it's certainly not going to be as effective. And so if you are going to use a face shield, I would highly recommend to also wear a mask underneath it. Clearly, air can get through the bottom of a face shield. It can come around the sides. It's not designed to really stop infected respiratory droplets coming from an individual wearing it, or to prevent it from being inhaled. It really is designed to really protect your eyes from inoculation.
I'm going to take a few questions really quick from the live. Someone wanted to know if they should wear a mask around the people in their home daily. I think you kind of touched on this before, but will you just expand a little bit on that?
Yeah, so, you really got to think about, who are you exposed to? Who is in your inner circle? So for example, I don't wear a mask around my wife and my two children, right? So we are together all the time. And so this is our inner circle. I know their risk, they know mine, and we can control that. And so in our home, which is a small home, there's only 4 of us, we don't wear masks in the home. That might be very different if I happen to live with my parents who are, above age 65 and are at risk. I'm going to work. Then I would consider wearing a mask, especially in kind of multi-generational homes with people at risk. But if you're in your home and you're all the same kind of risk category, then you don't wear a mask because you're exposed to them all the time in the home. That said, you have to really keep in mind who is in that home and what are their risk profiles. And so really understanding who you're going to engage with and knowing their risk profiles and what they've been doing is really important in terms of determining who you let into your home and expose to you that don't have a mask.
Another question we just got is talking a little bit about immunity for COVID-19 and whether there's any data or proof yet on if you can get the virus again or how much immunity we actually have towards it with antibodies and kind of what's been going on. I know we've talked about the HERO study that happened here in Utah, but do we have any further information on how we as humans are processing immunity for COVID-19?
Unfortunately, we don't. We don't have any definitive data to say once you've got infected and you develop an antibody response that you're protected from further infection. We know that the people that get infected, in particular those that are severely infected, will get a higher antibody response than those that are asymptomatically infected. We also know that that antibody response wanes over time. That is normal. That's what happens with all antibody responses. What we don't know yet is that antibody response protective for future infections? They're likely, based on the science, you'll likely have some level of protection for a period of time. We just don't know what that period of time is. We don't know if that's 2 months, 3 months, 2 years, or 2 decades. We'll really get a better understanding of that as we move into the winter, and we now have time for people to get repeated infections. We haven't seen any definitive repeated infections since this has started. And so that's a good sign. But at the same time, we don't know, how long immunity would last or if it's any kind of durable immunity. Time's going to tell on that.
Another quick question for you. Someone wants to know if there are any risks associated with having people outside together playing. They specifically said children, but it could be any age group, not wearing a mask. If you're playing maybe a sport or doing like a pickup basketball game with a bunch of friends, should you be wearing a mask in that instance or should you not?
Right. So, being outside compared to being inside is much, much better in terms of decreasing your risk. And so getting outside, increase that ventilation is so important. Okay, so being outside automatically decreases your risk. That said, if you are outside and in close contact with somebody, you certainly are at risk for getting this infection. So if you can imagine you're playing basketball against somebody who has COVID-19, you're breathing heavily, you're in close contact, that's a risk. Okay, so I do worry about these sporting events that are starting up, especially those that put people in close contact with one another, breathing heavily. That's a big risk factor for transmitting this infection, and potentially why we're seeing an increase in case counts in those that are 15 to 24. And so absolutely, when you put people close together, especially when you're breathing hard, that is a risk for COVID-19. Can you wear a mask while you're doing those things? I suppose you can try. And that would certainly reduce the risk, but it certainly is not going to be, super pleasant. But that would decrease the risk if you were to wear a mask.
Okay, 2 more mask questions for you. One person wants to know, how protected am I if I'm wearing a mask and I come in contact with someone who is not wearing a mask who potentially has COVID-19?
Right. So you're definitely more protected than if you weren't wearing a mask. We can't give you definitive numbers in terms of what your decreased risk is. And the reason we don't have that is because of the variability in masks that are out there. One person's cotton face covering, which is a single layer, maybe a buff worn over their head, is very different than a 3-layered cotton mask. Okay, and so we don't have good definitive data to say that if you're wearing a mask and you come into contact with somebody with COVID-19, that your risk is reduced 30% or whatever it might be. We know that it's reduced. We know that it's significantly reduced, but we can't tell you how much. What really reduces it even more is if that person infected was wearing a mask. And so if you're both wearing a mask, that decreases your risk considerably, likely by upwards of 80 to 90%. We can't unfortunately give definitive numbers just because of the variability in masks. And so what I would say is wear a good cotton face covering, one that has multiple layers. There's plenty of things online to show you how to make this and really protect yourself when you come into contact with people that may have COVID-19.
I'm just going to show my mask again really quickly. So mine also has, mine has 2 layers of cotton, and it also has a little spot for a filter or another piece of material, which is kind of nice. And it's cloth, so I can launder it after I wear it. So I feel pretty protected in something like this, as opposed to, like you said, like a face buff, which you can almost see through sometimes. I feel like if you can see through something, then it's probably not going to be as effective as you'd like it to be. Last question for you on masking. Someone wants to know how safe it is to fly on an airplane if you wear a mask.
So, we're getting more and more data to say that, flying is relatively safe as long as you take the appropriate precautions. There's a significant ventilation on airlines, and many airlines are requiring people to wear masks. They're providing masks. If they don't have one, they're giving them water as they enter, and so they're not going up and down the aisle giving people snacks. So I think you can do it relatively safe as long as you take the precautions when you're wearing a mask 100% of the time, only taking it off to eat and drink, and you're doing really good hand hygiene, not touching your eyes. These are high traffic areas. What a great place to go down and touch a hand rest with full of COVID-19 and put in your eye. And so I think if you can be really cognizant of very good mask use and good hand hygiene, I think, flying on planes can be relatively safe. What we worry about in our family is I've got a 2-year-old. I cannot keep that 2-year-old from putting things in her mouth. And so you really have to kind of think about who you're traveling with and whether or not they can protect themselves as well. But single travel without young kids, can be done relatively safe as long as you're wearing a mask, washing your hands, not touching your eyes, and really being cognizant of those things.
Those are some really good tips. I now want to switch to vaccines and clinical trials and just give an update on both. Someone specifically asked about clinical trials and just getting an update on how Intermountain has been doing with those. But if you can speak to both vaccines and where we're at with that, and then the clinical trial aspect as well.
Yeah, so vaccines are really moving along quickly. So in the past week, there's been reports out in the Lancet and New England Journal of Medicine. These are 2 really big medical journals that we have. One was the Moderna vaccine, and then the other was the Oxford vaccine with AstraZeneca, and the other is the CanSino vaccine. All of them reported very good preliminary results in what we call phase 1 and phase 2 trials. These are studies where you give the vaccine in varying doses to volunteers, and you look at the safety profile, and you look at whether or not they stimulate an immune response. It's nothing to do whether or not they're effective in preventing the infection. So in those 3 trials that all show very promising results, and these are looking at 2 different platforms. One is using an RNA vaccine, and one is using what's called an adenoviral vector vaccine. These showed really interesting, promising results in these smaller studies and showing that people are generating an immune response to the vaccine, which we anticipate will likely provide some level of protection if exposed to the virus. Those companies are all launching phase 3 trials. Either they've already launched it or they're launching them in the next 2 weeks. Moderna is launching a study here in the US through an NIH trials vaccine kind of group, and that should be released next week. And then both Oxford vaccine and CanSino is also launching global clinical trials in phase 3. These phase 3 trials are looking to enroll 30,000 people each. So these are huge trials looking at the effectiveness of the vaccine and looking for any adverse side effects. What you're going to see is you're going to see more companies release phase 1, phase 2 trials in the next couple of months, and then more companies releasing phase 3 trials or starting phase 3 trials likely October, November, December. And so a really kind of very dynamic landscape. And so far, pretty positive, intriguing results that really need to be followed up with rigorous phase 3 trials to look at safety and efficacy. So we're watching these things very, very carefully. The U.S. government is very involved in these. And the U.S. government is making some predictions and actually purchasing future orders of vaccines, thinking that they're going to work. And so the reason that that's important is that these pharmaceutical companies, as they're running these big phase 3 trials, they're gambling and saying, this vaccine is going to work. I'm going to start producing it at the same time as that phase 3 trial. And the minute that that's finished and we have approval, then I can start distributing the vaccine. And so they're doing it in parallel, not in series. And that allows us to, once that vaccine gets approved, start disseminating the vaccine across the US and across the globe. And so lots of risk taking by the vaccine manufacturers and people that are buying it, but it's because we need to really speed this process up. So hopefully that makes sense. In terms of clinical trials, we're continuing to offer a number of clinical trials here within the Intermountain Healthcare Network. What these trials are now looking at, the most exciting are what are called monoclonal antibodies. So these are antibodies that were developed to specifically target SARS-CoV-2 and the spike protein. And so when somebody comes in sick, we can give them a monoclonal antibody that attacks specifically that virus. And so there's a number of groups that have made these monoclonal antibodies, and we're now being part of some of these clinical trials that are studying that. In addition, we're studying a drug called remdesivir, which is a direct antiviral drug, in combination with a drug called tocilizumab, which really decreases the immune response that has been shown to be harmful in some of these patients. So multiple trials ongoing, both inpatient and outpatient, and we're happy to be part of them and be able to offer these services to our patients.
And there's a lot of information too on our website about our clinical trials. I'll put the link up afterwards so you guys can see that. And we've also gotten a few more school questions around kids. I just want to remind everyone that we're doing a specific Children in COVID-19 Facebook Live at 1:40 today, so in about an hour with 2 different doctors. So tune into that one, same place. That way you can get those questions answered as well. Eddie, I want to lead out with a reminder about Pioneer Weekend. It's a holiday here in Utah tomorrow. So I kind of want to talk a little bit about precautions, what people should be taking into consideration when they go out to celebrate with their friends and family.
Yeah, I mean, we kind of were prepping for this with the July 4th holiday. Here in Utah, we have a holiday called Pioneer Day, which is tomorrow. The biggest recommendation I have is get outside. Do not have parties hosted inside. I know it's hot outside, but decrease the transmission rate by getting outside, increasing that ventilation, and really decrease your gatherings to a group of people that their risks, they know your risks, and really minimize big congregate settings where you're really being exposed to lots of different people. And then if you can't physically distance, put a mask on. And really protect yourselves. I sound like a broken record, but really it's the simple things in terms of public health that really decreases transmission. Get space between you and other people. Wear a mask if you can't increase that space. Wash your hands and avoid close contact.
Well, thank you, Eddie. That's really great reminders for everyone. And as always, the COVID-19 hotline, if you would like to get screened and tested, is 844-442-5224. Our testing hours have changed slightly, so please make sure you contact that number just to get the most accurate, up-to-date hours. We don't want you guys to show up and have no one be there. So just keep that in mind. And Eddie, as always, thank you so much, and we'll talk with you next week.
Thanks, man.